and thank you for joining us for our session titled Trending Issue: Meaningful Research Includes Patients at the Table. My name is Suzanne Ruff, and I'm pleased to introduce this panel session. Professionally, I've been a freelance writer for the Charlotte Observer, and I'm the author of the nonfiction book, The Reluctant Donor. I am a member of the AAKP National Board of Directors, serving as the association's treasurer. I am also a living kidney donor. In my family, over 20 loved ones have battled or are battling a genetic disease called polycystic kidney and liver disease. The disease has claimed the lives of 11 family members, including my mother and a few short months ago, one of my sisters. I am the only sibling who did not inherit kidney disease. People ask me if I feel guilty about that, but I had nothing to do with my genetic makeup. But I do feel a great responsibility, which is why I became involved with AAKP, as did my father 40 years ago. I am obnoxiously passionate about kidneys and supporting families facing rare or genetic conditions which cause kidney failure. I am a staunch advocate for organ donation and living donation for at this point in time, and hope for artificial kidneys in the near future. I often say, when a person has kidney disease, the family has kidney disease. As a family member and living donor, I have had the great opportunity to represent AAKP on various research projects, including being a co-investigator on the Patient-Centered Outcomes Research Institute's project, putting patients at the center of kidney care transitions, also known as Prepare Now. Our work on this project was from 2015 to 2020, and it was an honor to know and work with the patients and other family members like myself. I've also been a key contact for companies supporting AAKP activities, and as a kidney disease subject matter expert on the AAKP Speakers Bureau. More recently, I had the honor of being one of the authors of the article published entitled Engaging Patients and Family Members to Design and Implement Patient-Centered Kidney Disease Research. Over the last 5+ years, AAKP has invested heavily in grassroots and virtual technologies to help patients and their families engage decision makers, researchers, scientists, and other influencers through our Center for Patient Engagement and Advocacy and our Center Patient Research and Education. Through our strategic partnerships with government, academia, and industry, we have been able to connect tens of thousands of new patient voices and their unique patient insights to those responsible for making informed decisions that impact some of the most vulnerable, ill, and underserved populations in the country. AAKP is building our capacities to better organize patients, address inequities, and to make certain patients have an even greater impact on issues related to care choice and innovation. Throughout the speaker presentations, it will demonstrate that AAKP is leading the way in engaging kidney patients like you listening across the disease spectrum in meaningful research and introducing you to a number of researchers and professionals who know the true meaning of patient engagement. It is more than a check off the box. It's the ability to put the independent patient voice at the research and policy table where it rightly belongs to drive a far larger and more representative number of patients in efforts that are already shaping the future of kidney disease treatment and public policy. Please join me in welcoming Dr. Elisa Gordon, Professor of the Department of Surgery, Division of Transplantation, Center for Health Services and Outcomes Research, and Center for Bioethics and Medical Humanities at Northwestern University, Feinberg School of Medicine, where my family had 7 transplants. I would like to turn it over to our next speaker, Dr. Gordon.
Hi, I'm Elisa Gordon. I'm a professor at Northwestern University in Chicago, Illinois. I'd like to thank the AAKP for the wonderful opportunity to present to you all. I have no financial relationships to disclose. Today I'm going to talk about patient engagement in research. Specifically, I'd like to share some general information about what patient engagement means, and then talk about some of my experiences in including patients in all stages of my research. So what is patient engagement? Patient engagement can be defined as the meaningful involvement of patients, caregivers, clinicians, and other healthcare stakeholders throughout the entire research process, from planning the study to conducting the study and disseminating the study results. Patients are so important to work with in research because patients are the experts of their disease. They have the lived experience of their condition. So knowing about patients' experiences of having and living with the condition is valuable to make sure that the research is designed in a way that makes sense to patients and addresses patients' needs. So there's a good rationale for doing engaged research. In addition to what I just mentioned, here are a couple additional points. There's a moral or ethical goal of empowering participants, and that's to help ensure or promote civically responsible research. Another goal is to ensure that the validity or design or applicability of the research itself is effective. There is a continuum in which researchers can engage patient stakeholders in research. You'll see that the last 2 rows at the bottom of this diagram show how patient stakeholders can be engaged in relatively short-term ways, such as by participating in interviews or focus groups, which typically last about 1 or 2 hours. Now, if you look above the horizontal line moving upwards, you'll see in purple the roles for stakeholders become more and more involved in the research. Importantly, the power dynamic between the research team and the patient stakeholder differs depending on where along this continuum, vertically speaking, the research team and the patient stakeholders are. In other words, if patient stakeholders are co-leading the study, like at the top, then they would share equal power in decision-making over the study as the research co-leader. But if patient stakeholders are sharing their knowledge, say by participating in interviews, then the research team leader is ultimately in charge of all decisions over the study. These different relationships present different pros and cons to stakeholder researchers and stakeholders. In my experience, I've worked with the bottom 3 options, running community advisory boards, conducting focus groups, and interviews, and I will share some of those examples in a moment. But first, I'd like to highlight some of the principles of patient and community engagement. I'd like to point out how there are principles that researchers live by when doing patient engagement or community engagement or even consumer engagement. While this particular set of principles is advanced by Northwestern's Center for Community Health for the purposes of community engaged research, they share an underlying theme with other types of engaged research, and that is about fostering empowerment among the group that the researcher is working with. So just to give you a couple examples here with regard to collaboration, one example may be meaningfully and mutually working towards partnerships' shared vision. With regard to respect, that can mean recognizing the validity of diverse perspectives, cultures, priorities, and needs. With regard to equity, that could be building on partner strengths and assets. Regarding transparency, that could entail having clear, frequent, and honest and open communications. With regard to impact, that could entail enabling findings to be shared with partners and stakeholders so that they too can use them. Patient input is valuable for improving research in many ways. One article on this topic summarized the ways that patients were engaged in research across over 100 studies. And the article found that when patients served as consultants and collaborators to the research team, they helped to determine the study design, selecting study outcomes, tailoring the interventions to meet the patient's needs and preferences, and enrolling participants. Many articles have reported that patient engagement provided valuable contributions to the research feasibility, acceptability, the rigor, and the relevance. There are a number of benefits of patient engagement. I'm just going to highlight a couple of these. Just at the real high level here, patient engagement has really helped to enhance the quality of healthcare. It's also been very helpful to improve health and treatment outcomes. And it's also really valuable that all of the input that patient engagement provides is helpful in the sense of being able to be shared with the community as well so that everyone can benefit. Now I'd like to showcase a few examples from my research of engaging patients in research. At the bottom of the chart I had showed before, I extensively engage kidney transplant candidates and recipients in interviews and focus groups to learn about their perspectives on a particular topic. I've collaborated with the AAKP to conduct interviews with transplant candidates several years ago, and that was about research on donated organs to inform policy about informed consent. And the AAKP leadership, Richard Knight and Paul Conway, were also involved in reviewing drafts of the survey instrument and the manuscript. And as you can see here on this slide, they were co-authors of the article that we published. Beyond assessing the knowledge and attitudes and beliefs of our patient participants, I've also engaged patients to better understand how to conduct my research and to do it more effectively. So, for example, I'm currently funded right now by the National Institutes for Diabetes and Digestive and Kidney Diseases to develop a chatbot, and that's a mobile app that simulates human conversation in order to help living donor candidates of African ancestry to learn about APOL1 genetic testing. I'm in the midst of conducting focus groups among African American living donors and the Chicago community members to identify how to make this chatbot better oriented to the information needs of living donors and on how to make the chatbot more culturally sensitive. And last weekend, we ran our first focus group. There were 7 people scheduled, but only 3 showed up. And low participation rates, that's one of the challenges that researchers face, but we still learned important information on how to improve this chatbot. I'm partnering with the National Kidney Foundation of Illinois, and together we received a seed grant from Northwestern's Center for Community Health to develop a community advisory board. And this is for the same NIH study that I just described about genetic testing of living donors. Altogether, there are 8 of us on the Community Advisory Board, or CAB for short, and we meet monthly for about 1 to 2 hours each month. I prepare the agenda with PowerPoint slides, and the original plan was to have in-person meetings, but due to COVID, we're meeting by video conference call instead. Not meeting in person makes it harder to connect with people on an interpersonal level. And that connection is so critical for developing rapport and trust to be able to engage in the complex discussions that we need to have. And that's especially important in the context for my study, which deals with sensitive matters pertaining to race and ethnicity. Fortunately, we have all gotten along really well, and we've learned so much from each other so far. Some of the questions that I've asked the CAB have included the following things, like how can we improve the informed consent form? And like what kinds of questions do you think living donors might have when we recruit them into our study? Because we want to be able to anticipate those questions in advance in order to be better prepared in answering them. So their feedback gave us the idea to develop a question and answer document for the research staff in order to have that handy to address the potential study participants' concerns. And hopefully that can make the recruitment process run more smoothly. Another question that I posed to the CAB was, when we get further along in the recruitment stage, we may ask them questions like, can you help us to troubleshoot why we have low recruitment rates? And they might have ideas as to what we can do to improve our recruitment approach. As I just alluded to, nothing in research is smooth sailing. There are always challenges. So I'm going to highlight some of the challenges that can occur with engagement research. So for example, it takes a lot of time to build relationships and trust. If you have a CAB, a community advisory board, the members may be more or less engaged. Some people might even leave. If they leave, then you'll need to take the time to bring those new members up to speed. Another challenge is that patients may not know about the science and the methods used to guide the study. But the good news is that there are always solutions. For example, in relation to the last point about building up foundational knowledge about science and methods, several of my early community advisory board meetings were devoted to co-learning. This was a two-way street. So while I led the teaching on the science of the study, my CAB members shared their insights with me about African American concerns about health and trust in the healthcare system. I want to end on a positive note. Learning about science is important and can take some time if one is going to be involved in doing it. It's really important. Fortunately, there's a free training program available online for community members to get certified in the responsible protection of human research subjects. I provided the link here at the bottom. So just so you know, if you're interested in pursuing that certificate, it takes about 2 to 3 hours to complete that program, and most of my CAB members have taken this training. I'd like to conclude by emphasizing that it's really important for research teams to include patients in the development of research studies, in the research conduct, and in the analysis process. This engagement is so valuable for improving, ultimately, patients' education or treatment or care or policy overall. And so I wanted to encourage everyone to get involved and to collaborate. I'd like to thank you all so much for listening. And if you have any questions, please feel free to reach out to me. You can contact me by email. You'll see my email and my office phone number are both listed below. So I look forward to hearing from you. Thank you again.
Thank you, Dr. Gordon, for that excellent presentation.